The terrible thing about COVID is not only the fact that people are dying and people are getting sick, but it is also, it has such a devastating economic impact. Most of the economies of most of the African countries are at a standstill. A country like South Africa, which relies on tourism, is devastated because tourism almost came to a standstill globally. So they haven't been getting the amount of tourists who go there. But they also have other forms of economies that has been devastated, the lockdowns, the markets and export and import industry in South Africa, and also mining industry. There is not a sector in South Africa or anywhere in Africa that has not been affected. The COVID actually will kill more people through a lack of economic well-being more than the disease itself.
That's certainly important to note there. So talk about South Africa in terms of not just the successes, but any struggles that it's had in this fight against COVID-19.
I think one of the major struggles for South Africa and many of the other African countries is that we don't manufacture vaccines locally, and we don't manufacture most of the medicines locally. So we have had to rely on the import from other countries, like from the West and from Asia. And unfortunately, we saw how the rich countries hoarded all the vaccines here in the United States and Europe, and African countries and others were left to struggle to procure vaccines. So South Africa is struggling because they don't produce the vaccines locally. They are also struggling because they don't have enough resources to procure the vaccines, because unfortunately some of them are expensive. For example, the AstraZeneca one that you just mentioned, they are being charged $5.25 per dose, right, while it's being sold in Europe for only $2.40. Why is that? That's exploitation, and it should be stopped.
So then talk about the South African president's plan to acquire enough vaccine, especially, as you mentioned, with some of this hoarding from richer companies and these more transmissible variants of the virus spreading.
First and foremost, I don't think they can do it by themselves. They need help. And there is help available globally at the International Monetary Fund, special drawing rights, which South Africa can access, $24 billion, which they can use to respond to COVID, buy vaccines, buy medication, and actually pay people who are going to be helping with the distribution of resources, train people, because they're going to need training, because this is something new for the entire country. And this is similar to other countries like my home country, Kenya. But the US is the one that has been standing in the way of the issuance of new special drawing rights. So we are calling upon the new administration, the Biden-Harris administration, to allow the issuance of new special drawing rights so that a country like South Africa can access the resources it urgently needs to save lives and also revive their economy, which has been devastated by COVID.
So it certainly requires a holistic approach. Certainly the vaccine is not the be-all, end-all to this, but just how key is the vaccine to South Africa's economic recovery post-COVID?
It is key. As you know, there is not treatment for COVID at the moment. And also, you know that there is 1.3 million people in South Africa are already infected. The population of South Africa, 58 million, is at risk of getting infected, especially with the new variant of COVID, because it's spreading faster. So the vaccine is key. So especially, they need to get that vaccine yesterday for frontline healthcare workers, so that they can start there, and then they start, like other countries are doing. But without that, they're actually losing very critical workers like doctors, specialists, doctors and also ministers. This morning, the president of South Africa announced that they lost a minister in his office. This is a devastating disease that is bound to kill more people without vaccines.
And just very quickly, we have about 20 seconds. Until a vaccine is widely available in South Africa and across the continent, what is some key support that people and businesses really need to try and limit the long-term economic fallout?
Definitely, they need to have better prevention strategies, support the government in the lockdown, support the government in providing the necessary basic tools of prevention of COVID, the spread of COVID, and more importantly, invest in the government so that they are able to buy through Africa Union and through the World Health Organization more vaccines so that they can treat their people. I know that businesses will not succeed if people are devastated with COVID. So businesses need to invest more in prevention of COVID through vaccines, but also through treatment, through prevention strategies that are available in the country.